Hi, my name is Heather. My student ID is 3062514, and today I'll be performing the Nursing Foundation's 2003 ESPN checklist for the NG tube insertion. So first and foremost, I will be just making sure that my workspace is clean and tidy, making sure I have all my resources available for me. Before entering the room, I will be looking for any isolation precautions and donning appropriate PPE for that, providing any patient privacy, going through my patient's past and present medical history and records, going through the doctor's orders before starting, and just making sure that I obtain any consent, going through any focus assessments, and making sure that my client is comfortable throughout this whole process. So first, what I'm going to be doing is just making sure that my client is in high Fowler's position and that they are comfortable, having a pillow behind their head for their shoulders and head to rest on. We don't have one, so we're just going to pretend for the sake of the lab. And at this point, I am going to grab some resources for them to use, making sure that I'm standing on this side of them, the side that I will be using the nair on. So here is a tissue, an emesis basin, and this is just for any sputum, glass of water with a straw, and then a drape here. So now what I'll be doing is I'm just going to perform some hand hygiene. So now, like I said earlier, I'm going to stand on this side of my patient and I'm going to measure with our mock NG tube. So first I'm going to start with the tip of the nose to the earlobe, down to the xiphoid process, and here I would be marking with any marker or tape. I'm going to put this off to the side here. If I were to use this for any suctioning, I would make sure that my canister is ready and connected to the wall with the proper suction tubing available, and it is working effectively for myself, but we are not using that, so I'm going to carry on. I'm going to perform more hand hygiene. I don't have any gloves, so I will just be verbalizing when I am going to don those gloves. So I'm going to don my gloves. I'm going to grab my mock NG tube. I'm going to inspect the anchor and also my tip, making sure that it is fully lubricated for my client with a water-based lubricant. I'm going to have my patient lift their chin up a little bit, and I will be going up this nair because I am on the side, making sure that I am going upwards along the nasal floor. I am going to hit a part here and the back of the throat where it's going to induce a little bit of gagging. So I'm going to have my client move their chin forward and drink some water. And just throughout this process, just breathe through their mouth until I've reached that taped end. I'm going to place this off to the side. If I were to continue with this lab, I would just continue to feed the NG tube through. But that is all for today. Thank you so much for watching.